Okay, so this is the first EDExam whiteboard session with a VAQ answer. This is VAQ number 7. I'm using a new program I've got. It's called Doodlecast Pro, and if you like it, if you like the VAQs being answered by video, then send me an email or just let me know and we can do more like this. We're going to crack into it now. I'm going to try and bang it out as quickly as I can, and we'll see how it goes. So some key points for this VAQ were in the question. There's a 39-year-old man who's been brought to the emergency department after a motorcycle accident. He's got moderately unstable vital signs, so they're all just on the cusp of abnormal. He's got a pulse rate of 95, a blood pressure of 110/70, SATs of 94%, and a GCS of 10. So you need to try and correlate these with the clinical picture of a major trauma patient, and in your 30% marks describe and interpret section, you need to make some sort of comment about these vital signs and how his injuries may explain them. So I'll just quickly point out the injuries that this guy had, and we'll see if we can correlate them to the vital signs. So to start with, he's obviously got significant trauma to, you can say he's a major trauma patient. He's got significant injuries to the head and face, the neck, and the astute of you will have noticed that he's got injuries to his anterior chest as well. His low GCS could probably be accounted for by the fact that he's just had a significant blow to the head. As far as his borderline tachycardia, hypotension, tachypnea and hypoxia, they could all theoretically be related to his neck injury and his potential airway issues. And you've got to mention as well, he's got a chest injury down here, so you've got to think about things like pneumothorax, retention pneumothorax, hemothorax, and also things like pericardial tamponade. A couple of other little things. He's got a bit of dried blood here, so he's obviously either got a nasal fracture or some sort of nasal injury, and he's also got some dried blood around his lips and teeth there. So he's got bleeding into his airway. He's got this swelling on the right side of his jaw, and this patient actually had a fractured mandible, which also compounds his airway issues. This really is all about airway, this question, and the astute of you will also have commented on the fact that he has a beard and a mustache, which is going to make bag valve mask ventilation very difficult and compound his airway difficulty. Lastly, you need to comment on the fact that he's got all this bruising around his anterior neck there, which puts him at risk for a multitude of injuries, including things like fractured larynx, and carotid injury are the two main ones. So don't forget the carotids are running right through here. He's at high risk for a carotid dissection from the direct blow he's had to his neck. So I apologise in advance. I wrote the question saying outline your assessment, which is probably a bit too broad for the 4 or 5 minutes you'd have left to answer this question. So assessment comprises history, examination and investigations. So that's probably too much for a single VAQ, but we'll just bang through it quickly now, and I'll point out what I think are some of the main points that I hope you covered. So just quickly, salient points about history, if you're just going to pick a few specifics. He's a major trauma motorbike accident. You want to know if he's wearing a helmet or other protective gear. You want to know if he's drunk, because that's going to affect your ability to assess his head injury. Of course, you want to know, importantly, about his past history, medications, allergies, that sort of thing. In particular, things that might contribute to breathing difficulties, such as a history of asthma, or other things that might give him breathing difficulty. And as far as the symptomatology goes, presently, you want to know if he's feeling short of breath, and if he's got pain on swallowing, because that might indicate that he actually has some significant underlying neck pathology. Again, the astute of you will have noticed that with a GCS of 10 and a fractured mandible, he's going to have trouble giving you a history, isn't he? But you still need to think about these points in your answer. So moving on to investigation. Clearly, major trauma patients need a primary, secondary and tertiary survey. You're just going to be doing mainly the primary survey stuff. So we'll go through that quickly, and then we'll throw a few extras in as well. So of course you want to know if he's got clinical signs of shock, and you refer that again back to his potentially beginning to be unstable vital signs in the question stem. You'd want to do a detailed airway assessment. In particular, you want to know if he has stridor, a hoarse voice or increased work of breathing, which might indicate that he has some significant laryngeal or tracheal pathology there from the blunt trauma. You want to go through this 12 mnemonic, which I'll go through in the next slide, and explain what I use when I'm assessing people with a neck injury, blunt trauma to the neck, because I use this every time. You also want to know whether he's got signs of a pneumothorax or pericardial tamponade. Okay, so this 12 mnemonic is the one I use when I'm assessing people with blunt injuries to the neck. I think I picked it up at the EMST course or something like that many years ago, but this is how I remember what to look for when I take a patient's collar off and I'm assessing them for blunt neck injury. You want to look to see if the trachea is midline or if it's deviated to one side or the other, which might indicate a pneumothorax. You want to see if there's obviously any wounds or holes in the side of their neck where there's either air or blood coming out. You want to feel for subcutaneous emphysema, which you'll often feel as little crepitations, often in the supraclavicular area, sometimes up into the sides of the neck, so that little bubbly, crackly feeling in the skin. And you also want to palpate, well, there's debate about whether you should palpate or not. You want to assess for whether or not there's signs of a fractured larynx. There's an argument that you shouldn't palpate a larynx if you think it's fractured, because if there's a crack through the thyroid cartilage and you squeeze it from either side with your thumb and your index finger to see if it's painful or not, that might collapse the larynx and the patient might suddenly have a respiratory arrest in front of you, and they can be extremely difficult to intubate these patients. So some people will say if you think they've got it, do some imaging, get the ENT people down and do a bit of a careful combined assessment and management of the fractured larynx if you think they've got it. And last but not least, you want to see if they've got distended neck veins, which this patient doesn't, which might indicate a problem such as pericardial tamponade. For an extra bonus point, you also might want to mention with this patient, given that he's got this bruising down on his anterior chest there, that he's theoretically at risk for a traumatic aortic injury as well. So not only the carotids, but possibly a traumatic aortic injury too. And lastly, in the examination component, you want to assess him for things such as midline tenderness. Again, he might not be able to tell you with a low GCS, but you just need to mention that you'd be highly worried about a cervical spine injury in this patient, and you'd also do a full neurological examination because of that risk of spinal injury. Lastly, we're going to talk about investigations. This guy's going to get CT'd everywhere, isn't he? I mean, he's had a significant head injury, GCS of 10, he's got a neck injury, and he's got facial injuries. So you're going to be doing a CT brain, CT C-spine, and a CT of his facial bones. You're also going to want to ask them to run some contrast through and get some specific views of his carotids, and most likely of his aorta as well, because, as we mentioned, this bruising down on his chest there. And you would probably extend that down and actually scan his whole chest. Because of he's a bit hypoxic and whatnot, you're going to want to look at his chest. And remember, when they do this part of the scan, they'll get his neck in and you'll be able to assess his larynx on that as well. And lastly, if you haven't run out of time already, you've still got time to keep writing. I'd go for the CT first. I wouldn't do this bedside radiology, pathology muck around in where you've got such a short space of time for this answer. I'd just go for the money, and I'd mainly talk about the CTs this guy's going to need. But of course he's going to need some bloods. He's a major trauma patient, so he needs a full trauma panel of bloods, including a cross-match. He's got blunt chest injury, so he needs an ECG. There's arguments about whether or not you should bother doing troponins if the ECG is normal in people with blunt chest injury, but that's out of the scope of this discussion. We might talk about that later. Of course, he needs a chest x-ray and a pelvis x-ray and other imaging as indicated by his other injuries that you find on his secondary and tertiary surveys. So there you have it. That's the first EDExam video whiteboard session VAQ answer. I hope you enjoyed it. Thanks so much for watching and supporting the site. If you want to get in touch with me, you can tweet me just at I can't even speak now, at EDExam. I'm so excited. You can check us out on Facebook, just EDExam, or if you want, you can email andy@edexam.com.au. Thanks so much for your support and for watching the video. If you've got any comments, leave a comment on the site, or just email me or get in touch. And thanks for supporting us, and we'll see you next time.